Come in.
Hello, sir. My name's Kiera. I'm a nursing student here with Advent Health University. I'm here to do your assessment on your arms, legs, and your stomach. Is that okay with you?
Yeah.
Would you like to use the restroom and have a glass of water before we begin?
No, thanks.
Okay, just give me a few moments and I'll be right back. So I'm going to close the curtains for patient privacy. Wash my hands for 20 seconds. 20 seconds has been fully stimulated. And can you state your first and last name and date of birth, please?
JD 1996.
Perfect. So patient stated first and last name does match with the hospital band. Okay, sir, so we're going to begin with your assessment on your stomach. Okay, are you experiencing any abdominal pain right now? Have you had any recent changes to your bowel movements? Okay, so I'm going to have you lay down, and then I'm going to raise your shirt and lower your pant line. Is that okay?
Yeah.
Okay. Is that all right?
Mm-hmm.
Okay, great. So upon initial inspection, patient's abdomen is flat and symmetrical. The skin tone is even and consistent throughout. There's no noted lesions or any masses seen underneath the skin. The umbilicus is midline and it's inverted. There is some hair evenly distributed throughout the stomach, but there's no deformities noted with it. There's no distension, there's no visible pulsations, there's no hernias, there's no striae, there's no scarring. Overall appears to be of abnormal consistency for the abdomen. All right, so I'm going to take a listen, okay? And before we do that, we make sure that our stethoscope has been cleaned and warmed. Perfect, so patient's bowel sounds are active. All right, so now I'm going to go ahead and percuss and let me know if anything is uncomfortable at all for you, okay? Try that feel everything's okay? Okay, perfect. So it's noted upon percussing that the patient's abdomen is noted to be tympanic in the right upper and left upper quadrants, and there is noted dullness in the right lower and left lower quadrants. All right, so now I'm going to go ahead and begin with palpating and let me know if you feel any pain or tenderness, okay? Any pain or tenderness? Okay, so patient doesn't report any pain or tenderness upon light palpation. And so now I'm going to go ahead and go a little bit deeper. I'm just going to make sure all your underlying organs are right where they should be and there's no changes in size, okay? Was that okay? All right, so perfect. So upon depalpation, patient doesn't report any pain or tenderness. It is noted that there was no masses felt. Upon depalpation, and underlying organs were in their corresponding quadrants. All right, that's it. All right, you can go ahead and sit up, Mr. JD. All right, perfect. So let's go ahead and move on to your arms, okay? Do you have a history of lymphedema at all? Okay, great. So let's just take a look here. I'm going to just put them out. Great. So upon initial inspection, the skin tone is even and consistent throughout. It's of a white color, but there is some dark undertones evenly distributed throughout. The skin tone is consistent. The arms are symmetrical. I'm going to check your temperature. Perfect. So patient's temperature is of a warm consistency and it's evenly distributed throughout the upper extremity. All right, so let's take a look here and get your pulses. And just turn it over. Perfect. So patient's radial pulse is noted to be a 2+ out of a 4-point scale. And patient's brachial pulse is noted to also be a 2+ out of a 4-point scale. And so what I'm going to do is check your pain sensation. So this is what sharp would feel like, and then this is what dull will feel like, okay, or a soft touch. I'm going to ask for you to close your eyes and then let me know where you're feeling it and whether it's sharp or dull, okay?
Soft left hand. Soft left arm. Soft left arm. Sharp left arm. Sharp left arm. Sharp right hand. Sharp left hand. Sharp right arm. Sharp right arm. Soft right arm. Soft right arm. Soft right hand.
Okay, perfect. So patient's pain sensation is intact and they're able to appropriately identify light touch. Perfect. So I'm going to take a look at your fingers. Perfect. So patient's capillary refill is less than 3 seconds. And so what I'm going to have you do is actually stand up. We're going to check the range of motion of your arms, okay? So you're going to go ahead and raise your arms up and down and back and down. And then you're going to go out to the sides. Watch your hand. And then back down. Great. And then you're going to put your shoulders in and put your shoulders out. Perfect. So patient exhibits a full range of motion of the shoulders. And so now for this one, we're going to start with our arms are by your side. Our elbows are going to be tucked in. We're going to go up and down, back up, and turn your hands over and back over and down. Great job. So patient exhibits a full range of motion of the arms. And then so we're going to check your hands now. So you're going to start with your hands like this. You're going to go up. Good job. Back to the middle. Back down. Good job. Turn them in. Good job. Turn them out. Good job. Spread your fingers. Make a fist. And touch each finger to your thumb. Great job. So patient exhibits a full range of motion of the hands and the fingers. And then so we're going to check your muscle strength, okay? So I need you to put both arms up. So you're going to pull, like kind of like you're pulling towards yourself. Great. Now you're going to push against me. Great job. And then I need you to squeeze both my fingers. Okay, good job. So patient's muscle strength is meant to be a 5 out of 5, and their muscle strength is able to overcome the resistance. All right, so lastly, we're just going to take a look at your legs, okay? Do you have a history of edema at all? Okay, great. So I'm going to ask you to lay down for this portion here. Just going to cover you over here because I'm going to raise your legs, your hands up just slightly. Perfect. So upon initial inspection, patient's legs are symmetrical. The skin tone is even and consistent throughout. There's no noted edema. There is some hair throughout, but it's evenly distributed and there's no patches or any variation seen in the distribution. There's no lesions noted. And let me check your temperature. Perfect. So patient's temperature is evenly distributed throughout, and it's of a warm sensation. All right. So now I'm going to go ahead and just check your pulses. Okay. Perfect. So patient's dorsalis patus is noted to be a 2+ out of a 4-point scale. Check your tibial. Perfect. So patient's tibial pulse is noted to be a 2+ out of a 4-point scale as well. All right. So then I'm going to go ahead and do the same thing. So let me know if you're feeling sharp pain or a soft pain and where you're feeling it, okay? Go ahead and close your eyes.
Sharp right leg. Sharp right leg. Sharp left leg. Sharp left foot. Sharp right foot. Sharp left leg. Soft left foot. Soft right foot. Right leg. Soft right left leg. Soft right foot. Soft left leg. Soft right leg.
Perfect. So patient's able to correctly identify light touch and their pain sensation is intact. All right, so then lastly, what we're going to do is we are going to check your range of motion of your hips, okay? So what you're going to do is you're going to bring your right leg or your knee to your chest. Perfect, and do it with your left leg. Great job. You're going to bring your left leg out, back in, and same thing with your right leg, out and back in. Great job. So patient exhibits a full range of motion of their hips. All right, and then lastly, what we're going to do is you're going to point your feet, flex, turn your soles in. Good job. Turn them out. Now you're going to bend just your toes and straighten. Great job. So patient exhibits a full range of motion of the ankles and the feet. All right, sir. You ready? Mm-hmm. All right, you can go ahead and sit back up. All right, so I was able to do the assessment of your arms, legs, and your stomach. Is there anything else I can help you with before I go?
No.
Okay, here's your cobalt. If you need anything, please feel free to press it, and I'll be back in about an hour, okay?